Robert Shanks here, and I'm with our IDD machine, standing next to our machine here, our IDD Therapy Spinal Decompression machine. And I just wanted to do a short video explaining really what IDD therapy is and how I got to using it in our clinic. In around, I suppose, 2009, 2008, I heard about IDD therapy, and it prompted me to look into it a little bit more, and actually went down to, at that time there were only 2 clinics in the country, and I went down to one of them and I tried it for myself. And having gone on that machine myself, I could actually feel what it was doing. I could actually feel what it was doing to my body, and I could feel this segmental traction that we're talking about, very isolated to the particular part of the spine that you, however you wanted the machine to be set up to target on that particular occasion. And that actually convinced me then, at that time, to trial the machine. So I trialed it for a year, and in my clinic, and I thought, well, okay, if it's as good as they say it is, I'll see the results for myself. And after 12 months, I have to say I was actually very impressed with the results that I was getting with my patients, and actually concluded that it was delivering superior results to the previous type of traction that I had been using. So then after that I decided, yep, let's get a machine myself, and really the rest is history. So we've had now this particular machine here since 2011, and we use it quite a bit, as I say, with our patients, and particularly I think, with the right patient selection is crucial. It doesn't work on every single type of back pain. I think it's wrong to just put any old back pain patient on these machines. You got to select them correctly. They've got to be the right type of candidate for it. And so particularly those that are having slipped discs, degenerative discs, have been suffering for several weeks, several months, and things aren't helping them, and they're trying to avoid more invasive techniques such as spinal injections and surgery. Now those things do have their place, of course, and in extreme cases surgery is needed, but there's lots of cases where, and I've seen where people are having conservative treatment, physical therapy, seeing their osteopath, seeing their chiropractor, seeing their physio, and they're just not quite getting there. And really this bridges the gap between those types of situations and the ones that would then need to maybe to consider having injections and surgery, and this really gives them a middle ground option. So what I'm going to do now, I'm actually going to, with the help of this skeleton here, in fact, I'm going to set the machine up and explain a little bit more to you about actually how IDD therapy works, and actually maybe you can see it working on the skeleton. Okay, so here we have, we're all set up with this skeleton to illustrate what happens with a real patient. So the patient's lying on here, and they're attached at the top here. That's attached, anchors this thoracic harness into the top of the bed. So obviously that goes around the rib cage, and that's designed to keep the rib cage and upper body nice and still. There's a pelvic harness around here which attaches around the pelvis, and that's then connected to the pulley, which you can see through here, which attaches to the computer tower. And obviously there's a knee, an elbow and ankle bolsters for additional comfort. Now a quick look at the computer screen here on the IDD therapy machine. What I've done here is just going to set it up to quite a light tension, because it's not I don't want to break the skeleton basically, but normally it would be a little bit heavier for a patient. Now normally this pressure here is a pulling force. This would be approximately half the patient's body weight minus 20 to 25 pounds to begin with, and then gradually going up in pressure through the sessions. Then we can select the treatment time, we can select the progression and regression time, which is basically how long we're going to be in the high tension and low tension for, and then also the oscillation. That's you can see a little wiggly line here. Okay, so I'm going to set this to 15 degrees. Okay, important to get the right angle we want. Now the angle determines really which segment we're going to be targeting, and there you go, 15 degrees, near enough. So a 15-degree angle, okay, we can see here, it's actually going to create an anchor point just a little bit higher than the base of the spine, so around about kind of L4, 5, probably more like the L3 here. Okay, now you can see in this particular case, this poor old skeleton's got a disc bulge at L3, so that's why I set it to that 15-degree angle, to try and target that segment and create our maximum distraction force at that level. Okay, so we're going to press start now, and then what it will do, it will ask us to press the stop button, which is here. So all these machines have a button which the patient can press if they need to stop the treatment if at any point they're not happy. We can see the gauge here on the computer that it's exerting a tension force, a gradually increasing tension force, and we can see the actual tension underneath versus the target tension. Okay, now what that basically means is if there's zero resistance from the patient, then these two lines will match completely. Now, in reality, this skeleton is actually quite rigid, and it's not that elastic, so we're going to see that these lines aren't really going to match. You can see here, even though it's only quite a light force, the lines aren't really matching up. But in reality, that would, in a real life patient, at just 20 pounds, that would be probably matching up quite well. And this is a way that we can see and monitor objectively whether we're stretching too much or not enough. And obviously we've got the patient to tell us how they feel, but also we can see on the machine here whether their tissues are resisting that pull on the screen is now. We're now going to release these catches here, one there, and now on the next high tension cycle, what we'll see, hopefully, as long as this works, first time I've actually done it on the skeleton, we'll see the bed opening up, and this will be where, if it was a patient, they'd be then feeling the full traction force, distraction force that we're using on that particular session. Creates that extra little bit of distraction at that segment. Okay, now the last point I just wanted to illustrate and mention, really, it's a relatively minor one but a very important one, is that these beds all have a bed tilt on them. Okay, so the beds can actually tilt up to help the patient come off, and obviously that's very important if the patient's in pain, helps them approach the machine from a standing position, and also brings them back upright once they've been on the machine and finished the treatment. It brings them back up to standing again, which I say for somebody who's in a lot of pain with their back and sciatica, that's quite an important feature. Okay, so there we go, that concludes this video. I hope that was useful. I hope that gave you some insights as to exactly what IDD therapy does, and the actual sort of mechanics behind what it does to your body once you're on the machine. My take-home message there really is, if you're a patient and you're suffering with either chronic back pain, chronic sciatica, nerve pain perhaps in your arms, or chronic neck pain, and it's due to degenerative discs in your back, and you've got an MRI scan that looks, something along the lines of the ones we've got there on that poster, then IDD therapy is a great option to look into and to try, and I would strongly suggest getting in touch with your local IDD therapy clinic, so that you can have this type of IDD therapy, spinal decompression. If you're a clinician or a therapist and you're, as I was at one stage, looking to offer patients a bit more than you currently have with just manual therapy techniques alone, then IDD therapy is a great treatment tool to have in your clinic, and certainly I'm very pleased that we have it in our clinic now alongside the additional services that we have on offer.